Dr. Mike Rahe was actually a student of our group here in Minnesota. He is now currently at the North Carolina State University, and he is studying pathology there and immune response of the pig to virus infections, respiratory infections. Thank you again, Mike, and the stage is yours.
Thank you, Fabio, and thank you for the opportunity to come here and talk about astrovirus 4 and to follow up that previous talk. So today we're going to talk about Astro 4 and basically how we see it as a cause of tracheitis and bronchitis in young pigs. And I apologize if you've heard some of this before. We'll go through a little bit of the summary of kind of how we've gone about investigating this virus, and then really the culmination is the results from our study that we ran at the USDA this past winter. So it's kind of where it all began. This is 2021. I was a diagnostic pathologist at Iowa State at the time. And just a routine submission, I thought. The history on it was coughing in 3-week-old pigs, the gross lesions I had on the floor that day. And I apologize in advance. If you don't like pathology, this may not be the talk for you. There's going to be a fair amount of gross and histopath. But the lesions I had that day, as you can see in the bottom, look exactly like flu, right? That's a classic checkerboard pattern. You'd look at that grossly and be like, well, that's flu. And I got it under the scope, and it looked like what we see on the bottom right here, which is these areas of bronchitis and tracheitis. So very attenuated epithelium, a lot of lymphocytes or the purple dots there coming in. Looks like flu, but it was PCR negative. And so I made my classic comment for a case like this, and hey, everything looks like flu. It's possible that you have flu here, and we just missed it with our PCR. Submission of oral fluids may be able to detect this virus in this herd. And so I sent that off, worked on the rest of my cases, and I get an email that night from the submitter, and he said, really appreciate the response and the case, but we've done this on a number of submissions from this flow. We know it's not flu. What else is there? And I thought, okay, this is interesting. So we tried some coronavirus PCRs. They came back negative. And then finally, I said, all right, let's go for next gen. And so we ran next gen. The first response I got on my next gen was, there's nothing else there. And I said, there's nothing else there. And they said, there's nothing else there except for GPS. And I said, this is not a bacterial, not a bacterial situation. Are there any viruses there? And they said, oh yeah, well, we detected this astrovirus in a fairly high number of reads. I said, that's what I'm looking for. I want to see something, a virus in high number of reads. And so we kind of got this astrovirus. Then it was like, well, what do we do with this, right? Astroviruses we kind of think of as like part of the virome maybe, but do they actually cause disease? And so fast forward 1 year and one porcine astrovirus 4 RNA scope later, and this is that bronchus from that case. Do we have a pointer, by the way, Fabio? Yeah, that's what that did last time. There we go, middle one. Okay, perfect, thank you. And so yeah, so you can see basically all this red is astrovirus 4 RNA within that bronchus, within that affected bronchus. So there's a lot of agent there. And if you're trying to wrap your head around what an RNA scope is, it's basically like IHC or immunohistochemistry and PCR had a child, and that was RNA scope. And so that's what, again, we're detecting here. So we use a probe. It detects the nucleic acid within our histopath slide. And so now y'all are thinking, well, what the heck's an astrovirus, right? We heard about it in the previous talk. Maybe remember something about it, porcine astrovirus 3 and encephalomyelitis cases. But like, what are these viruses? Well, they're fairly simple. They're non-enveloped RNA viruses. So you think about, well, maybe like PCV2, right? Non-enveloped DNA virus, but similar in terms of very small, very simple viruses. There's a lot of them. As humans, we have our own astroviruses. Avian have their own. Cattle have their own. Pigs have their own. When it comes to the porcine astroviruses, there are currently 5 genetic lineages that we understand, but they are very poorly characterized. So there could be a lot of diversity even within those lineages that we just don't know about because we haven't done the work yet to figure that out. As I touched on, astrovirus 3 is a cause of encephalomyelitis in growing pigs. Dr. Bailey Arruda, as well as some investigators at Iowa State, did a really nice job of characterizing that a few years ago. Porcine astrovirus 5 has been associated with enteritis in pigs. Astrovirus 4, there's been some reports on that with enteritis in pigs. There appears to be a tremendous amount of genetic diversity within astrovirus 4, mostly related to the capsid and the spike proteins. And so you can see those here in green, highlighted here. And again, we have no idea, again, how much diversity is there and if that diversity within those spike proteins would basically allow this astrovirus 4, these are potentially different lineages of astrovirus 4 to infect different tissues. And so work on that is ongoing. But to take this back to the pathology world, I had this case and I thought that was kind of interesting. And sometimes as a pathologist, you get these cases and you never see it again. And it's kind of like, well, that was interesting 2 years ago, but it's not a thing, or it's not a thing to worry about, at least. But I had a couple more within a few weeks, and I thought, well, this is starting to get more interesting. And I ran into one of our more seasoned diagnostic pathologists as I was just walking through the hall one day, and I talked to Rachel, and I said, hey, I've had these cases of astrovirus 4. Have you ever had any of these? And she's like, oh, I just had 2. And I said, all right, now this is we're starting to build something here. And so we wanted to ask the question. We wanted to basically see how often are we potentially missing this as a diagnosis. And so we asked the question of how many cases of suckling to post-weaning tracheitis or bronchitis are associated with porcine astrovirus 4. And so we initially kind of limited our search from cases of respiratory disease from neonates to 6-week-old pigs from the past 6 years. And that's just because we had formalin fixed paraffin-embedded tissue blocks from the past 6 years. And we started with that initial search. We got hits on like 1,000 cases of cases of tracheitis and bronchitis that hadn't been diagnosed with an actual etiology, but were kind of open, right? Within those cases, we started to narrow down. We looked for any cases that, if they didn't have influenza A virus PCR run, we threw them out. We considered that was most likely influenza A, right? We really wanted cases where we'd rule out influenza as a cause of again, tracheitis or bronchitis. We went through all the H&E slides on these cases, made sure that we had nice acute lesions, so we felt like if the virus is there, we're going to find it. And that narrowed our search from 1,000 down to 117. And then we made tissue and microarrays for our astrovirus 4 RNA scope. And I need to thank Schick at this point because they funded the RNA scope work. And so when we started this project, I think, we thought, well, if we find 10% of our 117 cases are positive, like that'll be a big deal. And so I took myself out of the equation at this point. I got some help from Dr. Pinheiro, Dr. Dershide, and Dr. Luna Michael. So they graded these as positive or negative. And we found astrovirus 4 within lesions in 73% of our 117 cases. So we were a little bit floored by that result, to be honest. And so basically our takeaway from that study and really from that work was we've got a really strong association between this virus and lesions that look a lot like flu, that look exactly like flu, to be honest. So the next step for us was, well, now we need to prove that this virus is actually a cause of respiratory disease. And so this is where I like to bring in kind of the smoking gun, theory or smoking gun hypothesis. And if you like Law and Order, this will make a lot of sense. And so with astrovirus 4 and this really strong association, we're at the point right now where it's kind of like, we have a body on the ground, the music's playing, right, dun dun dun, all that, and you've got somebody that they caught with a smoking gun. Now the question is, did they pull the trigger, or did they come along, find a smoking gun, and pick it up? And so to take that to our astrovirus, right, did astrovirus actually cause this lesion, or is it merely replicating within regenerative epithelium caused by something else? And so that's what we set out to prove here. No, it actually pulled the trigger on that gun. So the way that we do that is basically through a challenge study. Now the challenge with astrovirus 4 is that we aren't able to isolate this virus. There's been some reports out of China that they've been able to isolate their astrovirus 4s over there out of feces, but here in the US, as far as I know, no one's been able to isolate it to this point. What we got very lucky on is we identified a case where we confirmed that astrovirus 4 was within lesions. We had it at a very low CT, meaning high amounts of astrovirus 4 genetic material. We had really nice lesions, and then with that, all of our other known primary pathogens of porcine respiratory disease came up negative via PCR. And so again, we didn't want to do a challenge study where you also give the pigs PRRS, right? And then you're saying, oh yeah, it caused respiratory disease. Look how easy it was, right? Well, it could have been the PRRS. And so we got very fortunate on this case with our lung and our trachea samples. So we're ready to move forward. We had our inoculum. We needed to find negative pigs. And that proved a little bit harder than what we had hoped. But we were able to identify one research herd with 5 sows that were feces and nasal swab PCR negative. We then screened their piglets. So at 16 days of age, their piglets were nasal swab, fecal swab negative. And then we had a collaborator at UC Santa Cruz. When we were kind of struggling with, where do we go from here with this astrovirus 4 project, I just started cold emailing human astrovirus 4 experts. And I got a response from Rebecca Dubois out at UCSC, who was really enthusiastic. She said, if this is true that this actually causes respiratory disease, this would be the first astrovirus to do that. Like, we've known they're kind of cause of atrophic enteritis and diarrhea in humans, but no one's ever shown it to cause respiratory disease. And so she actually developed an ELISA for us to astrovirus 4. And so she was then able to go forward and screen these piglets for antibodies against Astro 4. And you can see here, hopefully you can see in the back, but these blue lines, these are just simple OD values here on the bottom axis. And so there are antibodies there, but it's fairly low levels. And so what we did is we went through and we picked out the 10 pigs with the lowest ODs, so the lowest amounts of astrovirus 4 antibodies from mom. And so we took those for our challenge study. Fairly simple study design. We kind of mirrored this off how you'd run a flu study design, right? Thinking that probably pretty similar in terms of, they're similar in terms of the cells they infect. And so we thought the timeline would probably also be pretty similar. 2 groups, 5 negative control pigs, 5 challenge pigs, intratracheal and intranasal inoculation, and then just following them for 5 days with nasal swabs and fecal swabs. And I should point out, this was probably 8 days before I left Iowa State to move to North Carolina State. And so it's a little bit optimistic on my end that this was all going to go smoothly. And on day 3 after challenge, I went into the negative control room with my grad student, Drew Noel, and the pig started coughing. And it was one of those deals where you go into a barn and you're like, you hear a cough and you're like, that was nothing. And then another pig coughs, and then another pig coughs, and suddenly you're like, no, this is something. And so we took our samples, went into the challenge pig room, and they were coughing, and we're like, okay, well, at least that's good. But walked away from that morning thinking we got flu in here. And so finished out the study 2 days later, and at necropsy, we had lesions that looked a heck of a lot like flu. And so checkerboard pattern, some areas of consolidation in here. You see this in this cranioventral area. Again, looked a lot like flu. Shout out to Phil Gauger and Calvin Coe for helping out on that necropsy day. Move forward to our histopath. A lot of bronchitis, bronchiolitis, and then half of our pigs had bacterial bronchopneumonia. And so you can see that here. So this was a trachea. There should be little kind of cilia on the surface here. We don't see that. We see kind of this hyperplastic regenerative epithelium, and then all these purple dots are white blood cells coming in there. This is a small airway which has been hit pretty hard by a virus. So we ran our PCRs for flu, and they were negative. And then we ran our day 0 pre-inoculation samples. And I love this one. It's just funny to look back and laugh at this one. So the oral fluids that we collected before we inoculated on day 0 had a lower CT than our inoculum did on day 0. And so these pigs were actually actively shedding a ton of astrovirus 4 at placement. And so we think what happened is they were from a farm where they had antibodies. Astro was probably circulating on that farm. They just hadn't been exposed and infected yet. They probably got infected the day before they left. We got them, and that's why we had them coughing so early on. So basically turned into another big case of astrovirus 4. And so we thought about, how do we move forward from this? And I gave this presentation, similar presentation, about 18 months ago, and somebody suggested CD pigs. And I said, I don't want to do CD pigs. I don't want to go that route. But after 6 months of basically striking out on finding negative herds, I contacted a friend at USDA, and Alexa Buckley had been fantastic. And she said, hey, we can do this in our herds here at the USDA. You all have the inoculum. Let's make it happen. And so It was funded in part by SHIC. Again, big thank you for that. And so a little bit more of a complex study design on this one. We had 28 CD/CD pigs housed at the USDA in Ames. With this one, we were going to do 17 challenged pigs, same intratracheal and intranasal inoculation, 11 negative control pigs, and then again, nasal and fecal swabs. We were going to take 3 different necropsy time points in here. So stopping at day 5 to necropsy a third of our pigs, day 8 to do another third, and then taking the rest of the pigs out to day 21. And the idea here was to look for, again, seroconversion to characterize that in the process. Jazz Stevens is a third-year path resident at NC State who works in my lab, and this was her primary project. All right, so let's move to the results. So PCR results on this, nasal swabs here on the left. You can see a pretty good infection curve off nasal swabs, which peaks at day 6 and then is gone by about day 12. We took fecal swabs in this study as well, and so the fecal swabs are interesting. They lag behind by about a day. They're never as low as the nasal swabs, and they're also gone by about day 9. And so we took intestinal sections with this study as well. We did ISH on them. We couldn't find any actual infection of the GI. Doesn't mean it didn't happen. Could have been in areas we didn't look at. Our working hypothesis on this now is that this is potentially virus that was basically coughed up and swallowed. So we're not really sure what to do with the fecal swabs. We did next-gen both samples, and they are the same virus. It's not like we had 2 different astroviruses in there. But yeah, that's kind of an interesting thing, I guess, to follow up on in the future. Trachea and lung PCRs, this was a little disappointing for us, to be honest. Those of you that have had cases of this, let's focus on the lung here, because generally that's what we get for diagnostic tissue. On a diagnostic case of Astro 4, generally those are in the 20s or lower. Our pigs never really got below, I think, like a 26. And so we got an infection. It wasn't as robust as what we had hoped for, but they did get infected. Let's move forward to the histopath. And all this was done by Dr. Stevens. She's blinded to the conditions of the animals. These are tracheas. So we have an unchallenged day 5 pig here on the left. And here you can see a nice respiratory epithelial layer. We've got cilia on the surface. That's the way it should be. If we move to the right, you have loss of most of that cilia. You've got some stacking of your epithelium. And then you have these, again, these purple dots or lymphocytes that are coming in. And so this would be evidence of a mild viral infection. So if we go forward to her scoring of these lesions, on day 5 here, you can see with the trachea, we see no difference between non-challenged and challenged pigs. And this is probably due to the route of inoculation. So if you remember back, we talked about intratracheal inoculation. So basically you take a tube and you put that down their trachea. And so along the way, you probably scuff some epithelium, and that's what we're seeing here. If we move to day 8, here we're starting to see actually significant differences between our challenged and our non-challenged pigs. So basically as that inoculation lesion heals, now we've got residual lesions from Astro 4 infection. And then in the bronchi as well, kind of a similar deal. We maybe nicked a bronchus here. We have some lesions here on day 5, but by day 8, we've got significant differences between our 2 groups. Move forward to our ISH results. We don't have these quantified yet, and so we'll use machine learning software to actually quantify the signal within these airways. We're in the process of finishing that up. But you can see here we have our unchallenged pig on the left, so we have no astrovirus 4 RNA-scope signal there. And then if we move over here to the right, you can see all that red, so all that nucleic acid within those lesions. And then we had the ability and a little money to do so, and so we thought, let's look at immune markers, and I like the immune system anyway. So if you look here on the left, you've got some T cells underneath this tracheal epithelium, which is just normal. And then if we look over here on the right, we've got basically an influx of T cells that are coming in there to basically eliminate our infected cells. And then the last part of this, so our seroconversion. So this was all done at UCSC by Rebecca Dubois and her lab manager there. So IgM first, thought this was kind of neat because it kind of reads the immunology textbook in terms of IgM. And so you can see in the warm colored lines, those are challenged pigs. The blue colored or cold, those are negative controls. And so you can see we peak at about day 10 for our IgM response to astrovirus 4. and then it really recedes over the next 2 weeks. IgG, what you'd expect, so it really takes off after day 14, and if had we taken this out longer, right, it probably would have peaked around day 28. So conclusions that we've drawn thus far off our work, so strong association of astrovirus 4 with tracheitis and bronchitis. Generally, that's been in pigs up to 8 weeks of age. I can't say we've had a case or I've heard of a case in older than 8 weeks of age. The pathology that we'll see or you may see if you have a case is really grossly indistinguishable from flu, and histopath is as well. It infects the same cells, it causes very similar lesions. And then based on our microscopic pathology from our CD/CD study at the USDA, Astro4, we think of it as a cause of tracheitis and bronchitis in young pigs. Next steps for us, really isolation of the virus is really our focus. I really want to run this again in conventional pigs. And we also need to start looking at evaluation of potential vaccines just to see if there's if they're effective and again, just reproducing it again in our conventional pig. There's still a lot to learn about the genetic diversity of the virus. There's a thought that most of our PCRs are designed to be sensitive, right? So we target conserved regions of viruses to do that. And so in this case, we know there's a ton of diversity in that capsid spike part of this virus. And so the PCRs are generally targeting the ORF1 region. So it's possible that we have, again, kind of two lineages within astrovirus 4, but time and more research on that will tell. And I'm happy to answer any questions that y'all have.
Thank you, Mike. Awesome work. Questions for Mike?
Thank you, Dr. Rahe, for the nice presentation. I get really excited about pathology. But my question is similar to the question that I had for Dr. Vanucci in the morning. When you were having those cases, did you see it happening in more than one system, more than one state? What did they have in common? Any seasonal effect, like anything that could justify the increased number of cases?
Yeah, it's a great question. We didn't look seasonal. That would be a really interesting thing to look at. We did look across states, and it was in every major pig-producing state. So there's 117 cases. It basically broke down by our number of submissions from those states. I feel like, I've talked to veterinarians over the last year and a half about this, and it's been like all of the big swine clinics I've talked to about this. And so it seems like it's an endemic agent at this point. The really big question I still have, and I'll harp on it again, is really, genetically, we're lumping these all under Astro4. When are they really all Astro4, or is there variation in there?
Very nice question, Janice.
Thank you. Great talk. Regarding the co-infection, maybe you have had this question before. So if you have had any co-infections that that were more consistent, and also if you checked like turbinates or lymphoid tissues for the presence of the virus. Thank you.
Great questions. The co-infection one is one that we really have, and that's kind of, there's multiple reasons for that. On the study that we did, we were focused on Astro4, but we wanted to look at other kind of, secondary primary agents, if that makes sense. So we know flu is a big problem, right? But what about PHEV? What about PPIV? And so we did parainfluenza RNA-scope. We also did PHEV. And we found PPIV, and I think it was like 4 of the 117 cases. And they were also positive for Astro4. And so then we were left with the question of like, well, are they working together? Is PPIV just there? And Astro is actually the one causing the lesion? We can't deduce that from that. But I think what it opens up, if we're able to isolate the virus, is studies where we can actually test that. And the big question is going to be, does Astro4 with influenza make influenza worse, right? So there's been a lot of questions on that. And that's not restricted just to the pig. On the human side, they have a lot of questions on that as well, of what happens if you get a co-infection between COVID and flu, right? You'd think, well, that two viruses together makes it worse, but if they're fighting over the same infectious cells, right, does one kind of win out? And does it matter then, that they're both there? So there's a lot of questions about that. And if we can isolate the virus, then we can actually study that. In terms of the turbinates, we did that with the USDA study, and they lit up. So it infects the nasal epithelium. We hadn't, going through the histories and going through kind of the two studies that we've done, we haven't seen pigs or had histories of pigs with tremendous rhinitis, though. So it may infect up there, maybe make them a little stuffy, but it's not like that causes, a ton of drainage or anything like that. So, yeah.
Any more questions for Mike? I may have one, Mike.
Sure.
So, trying to bring to the real world that you are today, I mean, most of the flu cases come with something else, right? All neutrophils all over. And what is your thought process to, okay, I'm going to look at the astro on this case, when you got negative for flu, but it's not that clean case that you got. You got
Sure.
a bunch of other stuff coming in.
Sure. Yeah, and I'd say I appreciate the question, Fabio, because it allows me to reiterate. So, on my end, and I'm not a diagnostician anymore, but the way I would think about it is if you have gross lesions in a history like we saw here, flu is still your number one differential far and away. Now, when you have those and the PCRs are negative, then let's look at something else, and that's when we start testing for Astro-4. In terms of any sort of characteristic lesion that maybe makes you think one over the other, I haven't found one. And so they look remarkably similar. And I would put in this, I've really tried to talk about that when we've talked about Astro-4. The trachea is very, very commonly disregarded. I think by pathologists as well as by submitters. But if you think about it, right, I mean, it's a tube that connects the mouth to the lungs, and it's just covered with infectious cells for flu and for astro. And so if you're looking at your submission protocols, and if for respiratory disease, a nice section of trachea as a pathologist is great to cut that in for histo, because it allows us to really, again, target kind of those epitheliotropic viruses. So.
Yeah, no, that's great comment. And, well, quick question, I'll do the transition on that question, is that, maybe you mentioned that, does it go viremic?
I'm trying to think on this if we actually ran that on that study. We have the serum for it. I don't think we ever actually ran it yet. So, yeah, that.
No, I was curious, and the reason I'm curious, and I will do the transition for the PCV, because our case here, Pablo, on the first PCVs back 2015, the NGS here, you were talking about the NGS, the astrovirus and other virus NGS. Our NGS here at that time picked up PCV-like, that sequence that we did, and the Astro-4 on the tissue homogenate. And I remember we did the RNA scope for both. I mean, we didn't know what we were looking at that time. And there was negative for, the RNA scope was negative for Astro, and we got those pictures from PCV3. That's a good transition. That was not intentional, but that's a good transition for the PCV. Thanks, Mike.